Keeping an eye on all of this is Solon Simmons. He specializes in American politics at George Mason University's Institute for Conflict Analysis and Resolution. Nice to see you, Mr. Simmons. Refresh our memories here, because over the past year and a half, the President of the United States had some very strongly held ideas about health care and about reform. The House had a bill of its own. The Senate had a bill of its own. How did all of these differ, and which version has the inside track and the best chance of getting passed?
Well, things are pretty narrow right now, and if you want to take the array of possible plans, you could have one which was entirely private insurance and run basically the way it is, what they call the status quo. On the other side, something more like you would have in Canada, a single-payer system where you effectively have government insurance. The left, of course, still would like to have something like a single-payer insurance plan and might even like to see this thing fail, what we have now. On the right, many of the plans that were developed had some of the characteristics we now see. The plan before Congress now is very market-based. It preserves the status quo for the most part, with a few changes, an exchange system for people who don't have care, and so on. So it's a market-based solution. We might think of it as a regulatory bill. And the president argues, and I think that there's good reason to believe, and he did this on Fox News, by the way, says that he's really been a centrist in this. He's tried to meet in the middle. He's taken the various approaches, let's say the best of all possible worlds as opposed to the ideal world, and brought that plan together and put it forward. It's very much like the plan they have in Massachusetts that the Republican Mitt Romney put together, although Romney says it's different. The main difference, he says, is that his was a state plan and not a national plan. Otherwise, the mechanics are quite similar. So what we have is a very centrist plan that is angering those on the left, for interesting reasons is angering those on the right, and has led us into what is a very shrill situation. I mean, if you watch that interview on Fox, it's fascinating to see the confidence that the reporter has in challenging the president. It's an uncomfortable moment, but I think it reflects the tension in the country and the polarization we now face on this issue. And so it's an extremely dense and confrontational environment we're in right now.
Well, and it's not just split between Republicans and Democrats. Even within the Democratic House, you've got the pro-lifers who are not happy. You've got the deficit hawks who are unhappy. You mentioned the liberals. And so, if the Democrats want a bill to pass sometime this year, they're going to have to whip their own House.
Well, they are, and that's all this. You see a lot of talk of corruption. One of the things that really has people upset, and I can understand why, is there's a sense that that the process of getting legislation through the Congress is very unpleasant to watch. Now, what's interesting is that on the Republican side, these procedures have been used. People point that out. And so that there's nothing especially unique about using some of the parliamentary procedures that they're using. But it's turning people off. There's special deals like the Cornhusker kickback and so on. They're getting people upset. If you're a Republican, this is win-win for you, really, though, because let's say that the thing goes through. You can say, well, this is the Alamo. We fought to the last man, and we'll win the next battle. In the end, Texas will be free. On the other side, if you can kill it, which is what Michelle Bachmann wants to do, you kill it, and then you've had the Waterloo plan, which they've been setting all along. The emperor is now dead. He has no clothes. So it's a win-win. The Democrats face a more difficult situation. They, as you say, they have dissent in the ranks, and for them, they have to gamble that it's better to be strong and wrong, as Bill Clinton once said. That is, if the public really doesn't want this plan, if they really don't like it, as the poll numbers seem to suggest, but they like the components, but the package doesn't work, then you're in trouble, because then you're wrong, and yet it's worse. Probably it may be worse for the Democrats to look weak, to not have been able to get their signature plan through. The Republicans can sit back and gather momentum for the next contest.
If Obama does not get a health care bill, how tough is that on him personally?
I think it's very tough, and I think he recognizes that's the main pitch. I mean, you mentioned there's an abortion issue that's in play here, and whether this is pro-life enough, the bill that's coming through the Senate. And Obama's effectively saying, if you don't pass this, we're in crisis. He didn't want to say that on Fox News directly. He says he's more worried about the American people who don't have coverage, but he knows it. Everyone knows it. I mean, I think that there's a way to exaggerate that. I mean, I think that political time is endless. It's glacial in a sense. So 2012 is way out there. One has no idea what could happen, but it's going to be very tough on him. But look, Bill Clinton went through this. Bill Clinton lost his health care plan. Remember, Hillary Care. And so Obama can probably live through it as well. It'll just be a replay of the 1990s, which was trench warfare for the most part.
Solon Simmons is at George Mason University. Thanks very much, Mr. Simmons. Appreciate your time, sir.
Okay, great to see you.